This segment sponsored by GBMC Healthcare.
I'm here chatting with head and neck surgeon Dr. Ryan Sobel, and we're chatting about thyroid issues, which affects a lot of people. So thank you for being with us.
Thank you for having me.
Of course. So what is a thyroid for those who don't know, and what does it do?
So the thyroid is a butterfly-shaped gland, and it's best seen on a cartoon model. So it looks like a butterfly. The majority of the gland are on both sides of the windpipe. So it's in the lower portion of the neck, in the middle of the neck. And there's a left lobe, which is on this side, as well as a right lobe. And it creates a hormone that a majority of the organ systems in your body need to help keep your metabolism where it should be.
Gotcha. So then what happens when it stops working properly?
You can have a variety of symptoms. Typically, over the long term, you can have symptoms that affect your GI system, your skin, your cardiovascular system. So if your thyroid is working too much, you can feel a little bit more amped up. On the other hand, if it's a little bit sluggish, then you may feel a little bit more tired, a little bit more intolerant to cold, things of that nature.
Oh, that's interesting. So at what point should people start to consider surgery to fix their thyroid problems?
And the way I break it down to patients is that thyroid problems can be either of the function variety, which is a less common need for surgery. On the other hand, they have masses and growths, which are little things called nodules that can grow over time. Sometimes they can harbor things like cancer. Those are a far more common indication for surgery.
Okay, so if I understand properly, there are two types of thyroid surgery, partial and then a total thyroidectomy. What is the difference between those?
Right, so I'm going to grab the model again. So with a partial thyroidectomy, we typically will remove half of the gland. So there will be a functioning half gland remaining after the surgery. That's typically something we would do for a variety of conditions. That can be from a functional problem or a mass or growth. For things that are more advanced, like a thyroid cancer or much larger diffuse growths and nodules in the thyroid gland, we would remove the entire thyroid, which is a total thyroidectomy.
So then what are the risks and complications that are associated with either of those surgeries?
There are a variety of risks and complications that you can have with any surgery, but specifically for thyroid surgery, a lot of focus has to do with the voice, as well as swallowing issues and calcium issues. There are nerves that are on each side of the neck. They're called the recurrent laryngeal nerve, and that is a very important nerve to monitor and locate and protect during thyroid surgery. Injury or weakness of that nerve can lead to voice troubles. For the most part, they will resolve after about three months or so, but it's certainly a concern for patients who use their voice on a daily basis.
Oh, that's interesting. So talk to us a little bit about the recovery process. It sounds like some speech therapy might be necessary. What else happens?
Well, for patients who use their voice professionally, we will always have an evaluation of the voice done preoperatively, so before the surgery as well as after, to make sure they're back to their functional status. But for the most part, patients actually don't have that much discomfort after surgery. There's a little bit of a sore throat when you swallow for the first 3 days, and that's usually from the breathing tube, so we get to blame the anesthesiologist for that one. But the scar heals very well. It winds up looking like a small skin crease by the time all's said and done. The pain isn't terrible considering this is major surgery. We certainly give patients pain medicine, but for the most part, Tylenol does the trick.
This has been so interesting, Doctor. Thank you so much for chatting with us.
Thank you very much for having me.